Neglected medium-term and long-term consequences of labor and childbirth. The journey of a woman through pregnancy, labor, and childbirth can profoundly influence her long-term health and overall quality of life. While the majority of the 140 million women who give birth every year do not encounter any significant health issue afterward, almost a third of them grapple with at least one long-term condition following childbirth. To better understand how complications happen and their impact on women's health, we can break it down into distinct stages: pregnancy, childbirth, the postpartum period, and the medium to long-term period. As a woman progresses throughout this journey and the various health stages, there are internal and external events which contribute towards shaping this experience. Pregnancy initiates a cascade of physiological, anatomical, and social changes. These alterations affect various maternal organ systems, including the cardiovascular system, immune system, and endocrine or hormonal balance. Occurring within the broader context of a woman's environment, social support, and physical and mental health, these changes can shape her overall pregnancy experience and health. These naturally occurring changes prepare women to cope with potential stressors during pregnancy. These changes also occur during labor and childbirth, where they could elevate the risk for some women to develop complications in the medium and long term following childbirth. The process of childbirth itself introduces significant changes to a woman's body. These changes alone influence her health and conditions experienced after birth. Interventions during childbirth, such as forceps delivery or intrapartum complications like prolonged labor, can further increase the risk of medium and long-term health issues. The birth environment and the quality of care received can either promote a woman's well-being during and after childbirth or exacerbate the risk of subsequent complications. While postpartum care services in the first 6 weeks can help identify and address some short-term complications, many women face pregnancy and childbirth-related issues that can emerge or persist months or even years later, and in some cases can persist throughout their lifetime. After 6 weeks postpartum, conditions such as pain during sexual intercourse, chronic pain such as lower back pain, and anal incontinence are prevalent, often lacking adequate care and thus enduring in the long term. Medium and long-term conditions can affect subsequent pregnancies, increasing the risk of uterine rupture, placental problems, or secondary infertility. Understanding and addressing these complexities is crucial for ensuring the comprehensive health and well-being of women during and after childbirth. This emphasizes why high-quality care around the time of labor and childbirth is so critical. The appropriate evidence-based use of intrapartum interventions, ensuring a safe and supportive birth environment, and timely recognition of and prompt action on any complications can all help prevent medium and long-term complications. To comprehensively address these conditions, broader and comprehensive health service opportunities are needed, which consider the psychological, emotional, and physical challenges that women face beyond 6 weeks postpartum. These challenges can widely affect a woman's health and well-being, and that of her family. Supporting women in navigating these challenges requires a flexible and responsive postpartum care model, one that is person-centered and respectful, but also multidisciplinary, with integration of diverse health services.